Okay, I want to say good morning to everybody that is here today. This is our ninth, the second last tutorial, and it's a pleasure to have you here. Today we're going to be talking about the left hemisphere versus the right hemisphere, the different functions, how we know about those different functions, and what we need to be careful of when we're thinking about left versus right hemisphere. We're also going to be covering quite briefly the differences between male and female brains. Okay, so first we're going to be talking about left hemisphere versus right hemisphere, and I think most people in the sort of westernized society have a basic understanding that there's a difference between left hemisphere and right hemisphere, but sometimes they're a little bit misguided in terms of exactly what the differences are, and there's almost a bit of a romanticism around it and an exaggeration of what the differences are. And it's important as neuropsychologists that you know what the real differences are and how that would affect testing people. Now there is an anatomical asymmetry in between the hemispheres. The right hemisphere is slightly larger and heavier than the left hemisphere, but the left cortex is thicker. And the left hemisphere contains relatively more gray matter. That's all good and well knowing that. Unfortunately, we don't really know why yet, but I'm sure in the next few years we'll find out why. And the right hemisphere extends further towards the front than does the left hemisphere. Have a look at this picture here. Remembering we're looking at the brain from the bottom up, so this here is your right hemisphere. Okay, so it extends further anteriorly, and the left hemisphere extends further posteriorly than the right. It's quite a subtle difference, so when we did brain dissections and so on, one hardly picks it up, but there is a slight difference. Quite importantly, the lateral fissure, or the Sylvian fissure, which is that fissure there on the side, is longer in the left hemisphere than on the right and has a gentler slope. So the temporoparietal cortex, ventral to that fissure, below that fissure, is larger on the right. Have a look, here's your right hemisphere. So you can see this area here is larger than in the left hemisphere there. The left side also has a larger insula. Now you remember what the insula is? It's that part over there. If you had to take the brain and pull it apart like that, that bit of cortex inside there, that's called the insula, and on the left it's larger than on the right. The left side also has a wider occipital lobe, whereas the right side has a wider frontal lobe. Again, it's interesting to know this. We don't always know why it is the case. We will probably, hopefully, discover in time. And the left occipital horn of the lateral ventricles is longer. This is generally speaking. Of course, there would be individual variation. Then the left side has a larger medial temporal lobe, and I'm sure you can all understand why that would be the case, because language is in the left medial temporal lobe. So the left is going to be larger, and the left has a larger temporal planum or planum temporal. Now, just to explain to you where that is, sorry. Have a look at this picture over here. This is the slice through the brain, and this is the temporal lobe. And if you were to take a section through that temporal lobe, this here is the planum temporal, and this here is the gyrus of Herschel. If you cut it through this way, here you can see there's the left temporal planum or planum temporal and the right one. Okay. So the left has a larger temporal planum than the right, but the right side has a double Herschel's gyrus, which is in the primary auditory cortex. If you look at this picture here again, here's the planum temporal, here's Herschel's gyrus. Okay. In this picture here, looking at it sliced through this way, here's your Herschel's gyrus there. There's your insula. Okay. So it's that part there that's quite different between left hemisphere and right hemisphere. And it is suspected that it has a lot to do with verbal ability, language. Yeah. And then the right side, the right hemisphere, has a larger medial geniculus nucleus. Now, just in case you can't remember where that is, I'm sure you do know where it is, but just in case you can't remember, I've just got a picture over here. This is the medial geniculus nucleus. It is part of the thalamus, and it is involved with a relay of auditory information. So I've just put a reminder there of what it is. The medial geniculate nucleus, or the medial geniculate body, is part of the auditory thalamus and is part of the relay to the auditory cortex, just so that you can remember. Because I think sometimes when you read these things, even though you've gone through all the anatomy and so on, sometimes these terms pop up and you think, oh, no, where was that again? So that's just to help you. Okay, and then the right side has a larger area of convexity of the frontal operculum. Now, the frontal operculum, or the operculum, is seen in this picture here. That green, all that green area, it's called the operculum. It is the area that covers the insula. So if you were to fold open the brain to look at the insula, it's the operculum that you're folding open. And the operculum is divided into different areas. And the frontal operculum is that part there. More on the anatomical asymmetry of the brain. What you need to bear in mind is that laterality is relative. It's not absolute. So, for example, the right hemisphere also has some language functions. So one's got to be very, very careful in saying the left is language and the right is visuospatial, because there is a lot of overlap. But one can say that the left has more to do with language than the right. And the cerebral site is at least as important as the cerebral side, where and why that is mentioned is when you're looking, if you're testing a patient and they have, for example, a very focal injury, just because it's in a certain area for that person doesn't mean that their dysfunction can be the same as somebody else's dysfunction if they have damage in exactly the same area. There's a very good chance that the damage will be, that the results will be similar, or the repercussions will be similar, but one can't say that with you can't be absolute about that. And also, whether, you know, you can say this person has injury on the left side of the brain, not the right, but where on the left side of the brain? You know, is it in the cingulate cortex? Is it in the prefrontal cortex? Is it, you know, exactly where is that damage? Because that could also make a very big difference. And there's certain areas of the hemispheres where the laterality is more prominent, like with the temporal lobes, and certain areas where it's not very prominent. And then laterality is affected by genetic and environmental factors. So again, if you're testing somebody, their genetic makeup and what they've been exposed to in their lives is going to affect how their brains have been mapped out. So one must just be careful of making too many quick assumptions based on sight. Now, one of the ways we know that there is a difference between left and right hemispheres because of the split brain studies that have been done, where patients were taken who had had Kamijarotomies. Now, Kamigarotomy is when the corpus callosum is cut through the middle and the anterior commissure. Because remember, you've got the corpus callosum connecting the main part of most of the brain, and you've got the anterior commissure connecting mostly the frontal lobes. And if all of that is severed, then one has a separate left and right hemisphere. Now, of course, one wouldn't just automatically do that. These patients are patients who had problems, for example, very bad seizures, so that the brain was severed to try and control the seizures. Which also says to us that these people don't have normal brains starting off with. So one needs to take with a pinch of salt the research that comes from this. However, some very, very interesting information came from it, and it has been verified through various other studies. Now, when the corpus callosum and the anterior commissure is severed, each hemisphere still receives sensory input from all the sensory systems. So, you know, the auditory will still go to the left hemisphere. All the sensory information will go to each hemisphere. And each hemisphere will still control the muscles of the body. So people will have no problem walking, etc. But the two hemispheres can no longer communicate with each other. And that is the important difference. Now, you'll read about this experiment in the Welsh book, and I just want to go through it with you because it illustrates this so well. Patient NG has had a Kamijarotomy. She stares at a dot in the middle of a screen. A picture of a cup is flashed directly to the right of the dot. She reports that she has seen a cup. A picture of a spoon is flashed directly to the left of the dot. She reports that she did not see anything. She is asked to reach with her left hand under the table and so select by touch only the object that is the same as what she has just seen. She chooses a spoon. The spoon she is holding is out of sight when she is asked what is she holding, and she guesses a pencil. Okay, so I'm going to break this down. So she stares at a dot in the middle of the screen. A picture of a cup is flashed directly to the right of the dot. Okay, so that information is going to the verbal side. So she reports that she's seen a cup. She can say it, seen a cup. A picture of a spoon is flashed directly to the left of the dot. But that, because it's in the left visual field, it's going to the right. So the right doesn't have very good verbal ability, so she can't really say what she said. So she says, well, she didn't really say anything. She didn't really see anything. But then she's asked to reach with her left hand, because the left hand is controlled by the right hemisphere, under the table, feel around until she can feel what she thinks she just saw, and she chooses a spoon. So her left hand, because it's communicating with the right hemisphere, and because what she saw was reflected in the right hemisphere, she can identify the spoon. Now, she still can't see the spoon, but it's under the table. And when she's asked what she thinks that object is, she thinks it might be a pencil, because again, the verbal side has been disconnected. So she can't say what she thinks she's felt, even though the right hemisphere knows she's feeling the right thing. Okay. Now, besides those patients, we also get a lot of information from brain stimulation, where people, while they are conscious, their brains are opened up, and it's the various areas of the brain are stimulated with electrodes. And this is generally what has been found. If there's stimulation of the primary motor cortex and those pathways, the result is localized movement. So the person will twitch, their hand will twitch, or they'll move their toes or their leg or whatever. If the stimulation is in the somatosensory cortex and its pathways, the result is numbness or tingling of the skin somewhere on the body. If it's of the visual cortex and pathways, then the result is a person sees, well, this particular person that they're reporting on saw flashes of light. And in the auditory cortex, they heard buzzing, this person heard buzzing sounds. But depending on where that person's brain is being stimulated, he might hear music, he might hear, it could be any sort of sound. And this tells us about the differences between the different areas of the brain. Now, stimulation of the right hemisphere is more likely to produce interpretive and experiential responses. So, you know, I mean, you can imagine if you stimulate the left side, you'll have more verbal responses. But the question was, well, what happens if you stimulate the right side? Well, as I said, you have more interpretive and experiential responses. For example, reproduction of visual or auditory aspects of specific earlier experiences. Those are memories that are triggered. But this one's particularly interesting, déjà vu. People have an experience of déjà vu, which suggests that perhaps when we experience déjà vu, maybe there's a little bit of something that's misfiring in our right hemispheres. Fear and dreaming states from the right hemisphere. It was also found that if that stimulation blocks certain functions, so for example, if a person's busy talking and the verbal areas are stimulated, it blocks their talking, suddenly they can't talk anymore. If they're quiet when it's being stimulated, then nothing happens. It's just when they're busy talking and that area is stimulated, and it blocks the talking. And then thought, well, what happens to the right hemisphere? Well, so the studies that were done, that are reported in Kolb, is that people then suddenly have a difficulty with judgment of line orientation. Now, I don't know if you know about the judgment of line orientation tests. Basically, you get different variations of it, but basically you get a picture of lines like that are numbered and they are at different angles, And you'll get sample lines, and the people are asked what numbers of these lines correspond to those lines, looking at the angles of the lines. So that's a judgment of line orientation test. And people who were going through this test and they were being stimulated on the right hemisphere, it blocked that ability to try and work that out. It also blocked the labeling of facial expressions and the short-term memory for faces. So we know the right hemisphere has a great propensity for faces and identifying faces and trying to understand faces. Now, of course, when we're looking at right hemisphere versus left hemisphere, what automatically comes up is a question about handedness. Left-handed versus right-handed. And you get basically two genetic populations of left-handed. That sounds quite obvious, but you get the familial left-handers and the non-familial left-handers. Now, that sounds very basic, but that's actually really important. Because if you are testing somebody and you see that they're left-handed, you need to ask them if they have any family members that are also left-handed. Parents, siblings, grandparents. Because if it's a familial left-handedness and there's a genetic component to it, then there's probably nothing wrong with their brain. If there's not a familial connection, then there's a chance, quite a good chance, that the reason they are left-handed is because something went wrong with the brain when they were when they were developing, or perhaps there's been an injury, or for some other reason that handedness has been switched. So it's important to ask that. You can see here that there are quite a few famous people that we know who are left-handed. Now, a bit more about handedness and speech. You will learn about the WADA test, where a certain substance is injected to affect the brain. It's called carotid sodium amybarbital, and it's injected, and what happens is it anesthetizes the one hemisphere. So in the olden days, they used to inject it into one of the arteries here. And this is the interesting information that was found. Because I don't know if you've also found this, but there's a sort of lay perception out there that if you are left-handed, then your verbal abilities are in the right hemisphere. But that's actually not quite correct. 98% of right-handers show speech disturbance when the left hemisphere is anesthetized, but not the right. Okay, so that one we explain. You're a right-handed person, so if you're going to anesthetize the left hemisphere, you're anesthetizing the speech area, so you're going to struggle to write. But 70% of left-handers show speech disturbance when the left hemisphere is anesthetized, but not the right. So 70% of left-handers also have their speech in the left hemisphere. 2% of right-handers have speech functions lateralized to the right hemisphere. So 2% of the normal right-handers actually have their speech in the right hemisphere. No right-handers showed bilateral speech organization. We have speech in both areas. But 15% of left-handers showed significant speech disturbance after either sides were anesthetized. So 15% had bilateral speech areas. So actually quite a small percentage. But it's important to bear in mind. And one needs to, if you've got, you need to ask yourself, well, if a person is left-handed, possibly because of brain damage of some sort, doesn't mean the speech areas might have moved over to the right side, in which case might there have been a crowding out of the visuospatial abilities. Now, there have also been many laterality studies on people who have normal brains, and one of the techniques, well, looking at it with a visual system, you have a thing called a Acoustic Scope, where images or words are flashed very quickly in front of the eyes to the various eyes. And the findings from there are that words presented to the left hemisphere are processed more efficiently than those presented to the right hemisphere. So, no surprises there. Faces and other visuospatial stimuli are more efficiently processed in the right hemisphere than the left. Okay, no surprises there, which is very nice because one doesn't want too many surprises. You want to feel by now that you've got a good grasp on things. Okay. On the auditory side, now remember the auditory is not as completely crossed as the visual system. Both hemispheres receive projections from each ear. I'm sure you remember that. But the crossed connections are more numerous than the uncrossed ones. So you still have very much a crossed over effect. And this is tested with dichotic listening tests. And the findings are that the right ear has an advantage for words heard. The left ear, there's a left ear advantage for recognizing melodies. And then just interestingly, Morse code operators, you know Morse code, the dee 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 dee, have a right ear superiority for the perception of the code. Now, just a little bit on the side. Just want to put this on. If any of you are interested in trying out a dichotic listening task, there are apps that you can get that have dichotic listening, and I'm going to give you some of the details a little bit later. But basically what you do is you go to this app, it's free, and you download it, and you set it for your own hearing, and you plug in earphones. I will let you come and try this afterwards. And it then sends sounds to both ears at the same time. So, for example, one ear will hear da and the other one ta, or maybe pa and da, but at the same time, and then you tap on the phone what it is that you heard, and afterwards it will tell you whether you're more left ear dominant or right ear dominant. Now, in practice, it doesn't really matter if you're left ear or right ear dominant, but it is just an interesting test, and if you consider that so many of our information comes from dichotic listening tests, it's just quite an interesting thing to do. So you're welcome to come and listen to that afterwards. With the somatosensory system, how the experiments were done there is that people were blindfolded and they were asked to do certain tasks with each hand. And one of the main tests used was the dicaptic test, where subjects feel objects, then look at an array of objects and select those that they previously touched. So they're blindfolded, they feel certain things, and then they take off the blindfold, and they've got to say what they think that they just touched. And the findings there are that there's a right-handed advantage for identifying letters, again, not a surprise, and a left-handed advantage for identifying other shapes. Very nice and consistent. Then we look at the motor system. But the motor system is quite complicated, and it was quite difficult to study the motor system. But there were two main research methods in studying this. The one was through direct observation, the other one through interference tasks. Now, with the direct observation, what was found was that right-handed people tend to gesture with their right hands when talking, but are equally likely to scratch themselves, rub their noses, touch their bodies with either hands. Okay? On a neutral block building task, subjects manipulated blocks with the right hand and supported them with the left hand. In the verbal task, like a verbal analog task, using crossword puzzles, there was a right hand preference. Okay, no surprise there. And in the non-verbal task, subjects made more movements with the left hand. No surprises there. And then just a reminder that the left side of the face displays emotions more strongly than the right, most of the time. Then with interference tasks, what they did there is they got musicians, I thought it was quite clever, musicians to learn certain musical pieces where they have to use both hands equally. And then they got them to either hum or to speak while they are busy playing that piece. And what they found is that speaking disrupted the playing of a musical instrument with the right hand, and humming disrupted playing the same musical instrument with the left hand. So when they spoke, their right hand faltered. When they hummed, the left hand faltered. Okay. Now, we all know that there is a difference between male brains and female brains. And again, I think this has been popularized and exaggerated in the media, and there are all sorts of books out about the differences and so on. There are differences, but they aren't really all that big. And there are just a few of them. Okay. I've put it in a table. You'll find this in your core book as well. In terms of motor skills, I actually thought they put it very delicately in the core book because they seem to want to balance out, both sides. But if one's looking at motor skills, then when it comes to men, they're better at throwing things. It must have been quite an interesting experiment to do. I don't know what they threw. And for women, they're more skilled at fine motor skills. So obviously there's a lot more to motor skills than just that, okay? But this is what has been reported on. In terms of spatial analysis, men were very much better, well, they were better at the mental rotation of objects and spatial navigation. And women were better at spatial memory than men, interestingly. When it came to mathematical aptitude, men were better at mathematical reasoning, whereas women were better at mathematical computation. In terms of perception, men were better at mechanical drawings, and women were better at the perception of facial expressions and body posture. When it comes to verbal abilities, women just definitely have a superior ability verbally, so their verbal fluency and verbal memory are very good, and they added in their aggression. I thought, should I put that in? Should I take it out? I can't really see how that fits in with all the rest of this. But I thought if I don't put it in, then people are going to wonder why I didn't put it in. So they do mention that males are more aggressive, which is perfectly fine because they have more testosterone. That's the way they're supposed to be.
It's amusing that they had nothing to say about males' verbal.
I know. They could have said something. All right.
What's the distinction between mathematical reasoning and computation?
All I can think, they don't define it in the book, the difference between mathematical reasoning and mathematical computation. I think what they're really trying to say is men are better mathematically with a mathematical thinking. What women are better at are once they've learned the formulas and applying the formulas. Just making use of those. We all know that this is relative. You know, this doesn't mean that all men are better at these certain things than all women, and that all women are better at certain things than all men. We all know of men who are very good verbally, and we all know of women who are very good spatially and mathematically.
And they are aggressive women as well.
And there are aggressive women as well. No, you're quite right. So this is just looking at it generally. And you know, if you've got a patient coming to you for testing, you need to know what are your general expectations going to be. There are anatomical differences as well between male and female brains. The men have larger medial frontal areas. Okay, they have larger cingulate areas. Now you remember the cingulate gyrus? I just put it in there for you just to help you. They have larger amygdala and hypothalamus, which I thought was very interesting. Didn't know that. I should have known that, I guess, but I think that's quite new. They have larger overall white matter volume. They have larger cerebral ventricles. They have a larger right plane and parietal, which is part of the supramarginal gyrus, and I just put that picture in just to remind you of where that is. And they have more neurons overall, and they have larger brains overall. Females have larger language areas. Okay, that's not a surprise. They have larger medial paralimbic areas, and I just put in here a reminder that the paralimbic cortex lies close to the limbic structures and is directly connected with it. And when you think about limbic, we think about emotions. They have larger lateral frontal areas. They have greater relative amount of grey matter. They have more densely packed neurons in the temporal lobe. They have more gyri, and they have a thicker cortex. So you need to know what these differences are. You will see when you read through Kolb, there isn't much of an explanation of why those differences might be there. But again, that is probably information that will come in time as people study this more. But for now, you just need to know that there are those differences. So you can see that there aren't really very, very great differences between male and female brains, but they're big enough. And I think the main thing that you need to know is that women are better verbally than men, and the reason you need to know it is because it affects your tests. When you do a verbal test, you ideally should have norms that are divided into male, female. Otherwise, the women might be looking like they're much better than they really are, and men looking much worse than they really are if you use combined norms. There aren't always norms available that are divided according to the genders.
And that also applies to spatial orientation.
And that would include, yeah, it would, your spatial tests. I thought this was quite a nice little summary that I found that I just want to go through, just highlighting some aspects of left-right. Your speech centers on the left, as you know. Right-handed writing comes from the left. The auditory cortex is from the right ear. This is your general interpretive center for language and mathematical calculation in the parietal area here. And your visual cortex is at the back here for the right visual field. On the right side, there's an analysis by touch. You've got your auditory cortex for the information from the left ear, your spatial visualization and analysis area, which is in the parietal lobes, and your visual cortex from the left visual field. So just have a look at that little picture every now and again. It just mentions a couple of things that I think are important to remember. Now, dominance. What is it and what is it not? In the last many years, I think there's been quite a focus for psychologists to test dominance. Hand dominance, eye dominance, foot dominance. You see which foot, for example, a child uses to kick a ball with, or which, if you give them something to look through, do they look through the right eye, the left eye, to test dominance. But you'll read in COB some quotes like this one: all evidence suggests that absolute inequality is rare, the more common relationships being one of relative inequality. Okay, so be careful of being too absolute. It's not accurate to speak of a dominant hemisphere, because you could have cross dominance. You might be dominant with the left hand, but dominant with the right foot, and with the eye, and does it really, I can't say does it really matter. It does matter, but it matters in certain circumstances. It's also not accurate to speak of a right-brained person or a left-brained person, which I think has also become a bit of a pop culture thing, and many books written on it and so on about, are you a right-brained learner or a left-brained learner, a right-brained person and so on. But that's not really accurate. And then just another quote: no one cognitive function is completely dependent on one hemisphere or the other. Okay, unless, of course, a person has had a Kamijarotomy, or something like that. But generally, every function is so linked with the opposite hemisphere. It's very, very seldom that you're only using one hemisphere. And it's important to remember that. And it's important when you're considering your tests and test results. For example, the VIQ and PIQ, verbal IQ versus performance IQ, be careful with that. There has been assumptions in the past that verbal IQ is left, measures the left hemisphere, and performance IQ measures the right hemisphere. It possibly does to some extent, but be very careful with that, because some tests, like the picture completion, which is a part of the performance IQ, also has a strong verbal component to it. So, and there are other tests as well where one just must be careful of it. So if a person has a significantly higher VIQ to PIQ, doesn't necessarily mean that there's been brain damage, or that they are their left hemispheres are or there's something wrong with their right hemisphere or anything like that. One just needs to be careful. Now, I just want to mention that you all know the digit span test, okay? And there's a visual memory span test, which is to a large extent a right hemisphere comparison of those functions of attention. Also using the Corsi blocks. You know the Corsi blocks? Okay, let me start with the digit span. So the digit span, that is the test where you say, repeat after me, and you'll say something like 1, 6, 7. And the person has to say 1, 6, 7. And then you make the string longer and longer and longer, and you're looking at their auditory attention span. The visual memory span and the Corsi blocks, the way the Corsi blocks works is that you have these blocks in front of you, you have numbers facing you, and you'll touch the blocks in a certain order according to the numbers that you see, but the person doesn't see the numbers. and then they have to touch it in the same order. And of course, then you get the reverse of both. The digits, they then have to repeat the string of numbers in reverse, and with the Corsi blocks, they need to touch the sequence in reverse. Now, not many of the tests nowadays come with Corsi blocks, but they do come with some of the tests, and I'm going to discuss it in a moment. The visual memory span you get from the old visual memory scales, and it's a flat piece of cardboard with little blocks on that you need to touch, but it's very prone to tester error, because you have a series of numbers. So let's say 1, 3, 4, 6, 2, and you've got a picture of the numbers of the blocks where they are, and you've got to remember to touch them in the right order, and then you've got to make sure remember the order and check that the person's touching them in the right order. The longer and longer it gets, the more difficult it becomes for you to keep track of if they're touching the right blocks, and then it becomes even worse, because then they have to do it in reverse. And you've got to remember the order that you touch them, and then you've got to watch the order that they touch it in. So it's highly prone to error. So, good news. There's an app. I don't know if any of you know about this app, which helps with the accuracy of it. It's called, if you look under apps and look for spatial tests, span tests. If you Google span tests, or you look in the App Store for span tests, you will find this test. And what is very nice about it is that it measures the accuracy. So let's see quickly. Well, basically, what comes up is a hand that touches the blocks, and then the person has to touch the blocks. And then either forwards, and then they also have a reverse one. And of course, because it can be recorded where they're touching it. So one needs to be careful with this, because now we don't have accurate norms, South African norms for this. But if you want to compare it perhaps with another visual span test, then it might be quite a helpful one, because you know it's going to be more accurate.
Is that one a particular name for that one?
It's just called span tests. It's free to download. So I know when I first saw it, that's actually the first thing I thought, oh, what about practice effects, although I think very few people would actually be interested in downloading this, because it's not fun. But one does need to bear that in mind as well.
Sorry, I just want to ask, auditory span and visual span, would it be the same? Would a person that would get 5 digits in a row, would they also get 5 visual? You know what I mean?
Yeah, not necessarily. Not necessarily. One would need to convert each one to a percentile or something, and then you can compare them. That's a good question.
It'd be interesting to see.
I think one of the challenges we have in neuropsychology in the time that we're in is that there are so many of these brain exercises and things that people can do online. And I did an assessment of somebody who thankfully was very honest with me, because I did a strip test on him, and he said, I've practiced this over and over and over, because there's one like this on my computer. And he's been doing it to try and stimulate his own brain and try and recover some functioning and so on. I thought, my goodness, it didn't occur to me to ask if any of these seem familiar, which one really needs to do, and hope that people are honest with you. But that is quite a big challenge now. Your verbal fluency tests, we all know those. It's like your FAS, name as many words beginning with the letter F as you can in a minute, etc. And a good visuospatial comparison is a design fluency test, such as the 5-point test. Now you get design fluency tests with, for example, the DKEFs, but the 5-point test is something that you get in the Spreen and Strauss book. I'm going to give you the reference to it, and it's something you can actually copy straight out of the book. One doesn't need to purchase it, and it's quite a good little test to use to look at design fluency, and it's got norms. And then, of course, your Ray complex figure, delayed recall. You're looking at visuospatial memory, delayed recall and learning, as the verbal sort of correlate to that, quite a good one, is a Ray auditory verbal learning test, where you're looking at recall of verbal information that's been learned. When you're doing motor tests, make sure you use both hands, and you will need to ask, are you right-handed or left-handed? Because I don't know if you're like me, I don't always notice. If somebody's writing something, I don't always notice if they're right-handed or left-handed, because I'm probably thinking of something else. So do ask, are you right-handed or left-handed? With motor tests, you normally start with the dominant hand first. And also tests of touch. For example, if you're writing letters on a person's hand or something, or you're doing an astereognosis task where you're asking them to close their eyes and you put an object in their hand, they need to feel it, make sure you test both hands. And then always look out for different norms for males and females on verbal tests, like verbal fluency. Just some additional comments. I just put this together just for your information's sake. Here's the SPAN test that I showed you. If you go to an app store and you put in SPAN test, you're likely to find it. This dichotic listening app, that's what it looks like. It's called iDichotic, also from an app store. And then the Corsi blocks that I said, one of the Vechsler sets that you find it in is the Vechsler Nonverbal Scale of Ability, which is a test that not a lot of people know about, but it's a very, very interesting test. And it's really a test for people who cannot speak or they have speech difficulties, but you want to assess their general intelligence. You want to get a measure of IQ, but they're verbally challenged, then you can use this test, the Vechsler Nonverbal Scale of Ability. It's also very nice for people who do not have English as a first language. So a lovely test to use, and it has, there you can see little Corsi blocks, has these little Corsi blocks that are very handy. And then the 5-point test looks basically like this. You have these little blocks with 5 little dots in it. The test itself doesn't have the lines drawn in there. That is part of the test that people do. You ask them to, in each block, they need to make a different design connecting the dots. And that you will get in this book, a compendium of neuropsychological tests. If you don't already have this book I strongly recommend that you get for yourself. By Esther Strauss, Elizabeth Sherman, and Alfred Spreen. This is you can't see clearly there, it's the 3rd edition. I think that is the newest edition. If there is a newer edition, then try and get that edition. But what makes that book so wonderful is it's packed full of tests and norms and studies that are done on tests, and it's a very, very handy book to have if you're going to be doing, or if you are doing neuropsychological assessment. Now this is your required reading for the month. It looks like a lot, but it's actually not that much. I think this month is actually quite an easy month in that sense. So I want to say to you, if you are lagging behind, try and use this month to catch up. Because with the next tutorial, we're going to be doing several chapters in LESAC that I didn't want to touch on today because we're looking at the finer aspects of testing and statistics and so on. And I wanted to put that all in one tutorial. But it does mean that there are many chapters in LESAC that you're going to be having to deal with after the next tutorial. So try and catch up with all your work. And what I've also added in here are the articles, the 2 articles that SACNA wants you to read. By Matarazzo and Victor Null. If you don't have the articles, please just ask me for them. This is what they look like. Now, the one article, this one by Matarazzo, is a very, very important article. It's quite an old article, but it remains very important because what it points out are some of the statistical things that you need to be aware of, like standard error of measurement. If you measure somebody, and let's say they fall on a scaled score of something, you need to know what the standard error of measurement is. So, because it doesn't mean that they scored exactly that. One has to take that into account. It means that they might have been scored between, let's say, 8 and 10, or even a wider range. And what this article is pointing out is that more and more attorneys in court are becoming wizened up regarding psychometric tests, and they know how to criticize the tests. And if you're going to go into court, you need to know what the psychometric qualities are of your tests. So it gives you a lot of information about that. And then the other article by Victor Null is also a very, very old article, and I was wondering why in the world did they put this in? But if you go through it, firstly the history is quite interesting, because it's the history of the Wechsler test, like the Wechsler IQ test. There was a time during apartheid where we couldn't get the Wechsler test, so groups of people almost kind of made our own Wechsler test, and but it was very, very flawed. And this article talks about that, but what makes it very interesting and what makes it relevant today is some of the statistical information in here and considerations that we need to bear in mind for the Wechsler test that we use now, or any test for that matter. Okay, so do try to go through these as well.